The nasal septum is a wall that exists between the right and left side of the nasal cavity and divides it in half. It consists of bone and cartilage. Oftentimes, the nasal septum can be deviated. Oftentimes, this deviated septum will cause some nasal obstruction, which then prompts a patient to come in and see us. In order to fix a deviated septum, a patient undergoes a procedure called a septoplasty. During a septoplasty, what an ENT provider will generally do is we make a small incision inside the nostril of the nose. No external incisions are made. There's no external changes to the size, shape, appearance of the nose during septoplasty surgery. And what we're doing during that procedure is we're dissecting out all of the bone and cartilage. Once we get everything nice and isolated, we're then able to recontour and then relocate the area of that nasal septum to a more midline position so that you can have proper nasal breathing on both sides. Septoplasty procedure is a fairly minor procedure as far as the spectrum of surgical interventions go. It usually takes anywhere from 1 to 4 weeks to totally recover from a deviated septum repair and to get you to the point where you're feeling like you're breathing better. Oftentimes people are unclear whether or not they're good candidates for septoplasty, and sometimes it can be hard to know even if you have a deviated septum to begin with. Some of the telltale signs of deviated septums are mouth breathing, nasal congestion that ends up being worse on one side in comparison to the other, and oftentimes disrupted sleep. One of the most common questions we get here at Capital ENT Sinus Center is septoplasty an effective surgery for snoring? That's a more complicated question to answer. It really kind of depends on what the underlying anatomical makeup of the individual is. The short answer is, if you have a significantly deviated septum that's causing you to do a lot of mouth breathing at nighttime, definitely deviated septum repair can help snoring in that situation. Is septoplasty surgery painful? Generally on a scale from 1 to 10, with 1 being the least amount of experienced pain and 10 being the worst amount of experienced pain, septoplasty falls right in the middle between a 4 and a 6. It is not infrequent, however, for patients to report minimal to no pain following deviated septum repair. If people who undergo deviated septum repair experience pain, there's certainly medicines that we can use to treat that. We try to treat it with some over-the-counter medications initially, including Tylenol and Motrin. If that isn't strong enough, there certainly are some prescription strength medications that we can provide you to make it easier with your recovery. Is it worth it to fix a deviated septum? Yeah, honestly, it just depends upon the individual. I've seen plenty of patients out there in the community that have really significantly crooked septums, and I tell them, look, this isn't worthwhile pursuing. Those patients that really should consider this are those folks that have difficulty breathing through their nose. Oftentimes, people who have difficulty breathing through their nose will note that they have trouble sleeping at nighttime. When they wake up in the morning, their mouths will be dry because of their excessive mouth breathing and the nasal congestion that is experienced during sleep. A lot of times, people that have nasal obstruction that's significant and due to deviated septums will report that they have decreased exercise tolerance, so they'll sometimes feel like they have shortness of breath. So in those particular situations, it's definitely worthwhile pursuing. You know, deviated septum repair can be as easy as a 15-minute procedure or a 45-minute procedure. It really just depends on how significant the anatomical abnormality is. If you have really deviated septum, it's going to take a little while, but we just like to take our time and make sure we get the job done right. A common thing that we get asked are, what are the benefits of nasal breathing? So the benefits of nasal breathing are several. Oftentimes, people that can breathe normally through their nose will report increased restfulness after a full night of sleep, increased exercise tolerance, and it's also generally good to be able to breathe properly through your nose to help promote proper oral hygiene. There have been studies that have shown that people that do a lot of mouth breathing have a shift in the microbiome, meaning the bacterial makeup in their oral cavity, that causes a patient to have a propensity to developing dental decay and gingivitis. How do you know if you have a deviated septum? Really, one of the most common symptoms that we get as ENT doctors is nasal obstructions. That's the number one sign that you have a deviated septum. How do we figure out whether or not you have a deviated septum? Usually that's pretty easy. We can do some diagnostic testing here in the office, which includes nasal endoscopy or a simple in-office CT scan that can give us a definitive answer: yes, there is a deviated septum present, or no, there is no septal deviation noted. Generally, nasal obstruction refers to an individual who can't breathe properly through their nose. Oftentimes, those patients will have one side of their nasal cavity that's completely blocked off. They can't move any air whatsoever. So that's commonly what we're referring to when we describe patients that have nasal obstruction. If you feel like you can't breathe properly through your nose, oftentimes you'll notice that your sleep is disturbed. You'll toss and turn all night long, trying to find that perfect position to be able to breathe through the nose. Typically, people will report disrupted sleep and not feeling rested during the day. People that have nasal obstruction will oftentimes feel that their nose will get blocked off due to the increased blood flow to the nose. People that have nasal obstruction will also report issues with the mouth, like bad breath and an increased susceptibility to cavities and gingivitis. If you've had long-term difficulties breathing through your nose, come see the nasal and sinus experts at Capital ENT and Sinus Center so we can help you achieve the nasal breathing that you're looking for.